This week on Quality Digest Live, we chat with Larry Spears about FDA initiatives that affect the life science industries.
Plus, 3 companies using automation to cut waste. That and more when we come back.
This episode of Quality Digest Live is sponsored by Hexagon Metrology. Hexagon carries the widest range of quality brands. With its extensive support network, Hexagon is also your partner. Hexagon Metrology. We are metrology.
Welcome back to Quality Digest Live for April 17th, 2015. QDL is your weekly look at who and what is making the news in the world of quality. I'm Mike Richmond, publisher of Quality Digest.
That you are. And I'm Quality Digest Editor-in-Chief, Dirk Ducharme. So whether you agree or disagree with the Affordable Care Act, Obamacare, one thing it has done is to shine more light on how our current healthcare system works, particularly, in terms of the quality of care. One of the hallmarks, if you will, of Medicare and Medicaid, for example, is that it is a volume-based system. What we mean by that is that healthcare organizations are rewarded, were rewarded, I should say, on the number of tests, the number of patients, the number of procedures, and so forth that they ordered or that they served, regardless of whether those services helped or harmed the patient. So it was a volume-based reward system. And this has been slowly changing since the Affordable Care Act was passed. In her article, 3 Reasons Hospitals Resist Investing in Quality, Dr. Alexandra Brown, medical doctor Alexandra Brown, explains why entrenchments in a volume-based system makes it difficult for hospitals to invest in quality. Brown is the associate director of the Healthcare Delivery Institute at Horn LLP. Well, first, as Brown points out, when you're operating within a volume-based environment, it causes hospitals to focus on growth, that is, expanding services and the like, without paying attention to costs. The more services you offer, the more patients you can handle, the greater number of procedures, the higher the volume, and therefore the higher the rewards in a volume-based system. There's no real incentive to understand the costs in that model. Everything is based on growth, and you want to have more services. You want to be able to do more and more for the people who come in, because the more and more stuff you can do for them, the more tests you can order, the more you're going to be rewarded in this type of system, which has changed, by the way, or is in the process of changing because of the Affordable Care Act. But because of changes in how healthcare works now, as hospitals move toward a more value-based rather than a volume-based system, many are trying to do so within an inefficient system, says Brown. In other words, creating value takes more work, which is hampered by these inefficient systems that are the legacy of a volume-based system. So the issue here is that, okay, we've got to kind of revamp the way we're doing, we've got to cut costs, we've got to do all this, but they're trying to do it within a system that is rife with inefficiencies because they never had to deal with inefficiencies before. And so now they're kind of being tasked to change the way that they're working, but they're working in a legacy system that kind of hampers them from being able to do it.
Right. Really make the changes they need to make.
Exactly. And part of the solution, says Brown, is to first reduce waste and other costs before trying to expand. And she sums it up this way. She's got a great quote. If you think about it, says Brown, there is tremendous opportunity with far less risk when hospitals invest in quality improvement as a way to increase their bottom lines. Every hospital, clinic, and surgery center has waste. Investing time and resources in reducing that waste pays practically every time. If done correctly, capital expenditure, on the other hand, can result in losses, especially in today's resource-poor healthcare environment. But in order for this to happen, obviously, it means a change in mindset for administrators, and this is a big deal. They're used to this model of expand, add more services, et cetera, and now they're having to go, no, wait a minute, I don't want to do that. I got to focus on efficiency, and then maybe once I get that in line, then I can look at expanding.
I always the analogy I always think about when I hear about things like this is when you have a home, and you want to put in these great, beautiful new windows, but the whole house needs to be totally burned down to the studs and rebuilt. It's
Right,
like,
right.
well, don't put the windows in first.
Yeah.
It's like, get it down to the studs, build it up, and then put in the nice windows, right?
Yeah,
So
exactly.
It's
Yep.
kind of the same thing. Thanks, Dirk. All right, well, we talk all the time on the show about how academia needs to do a better job of preparing graduates to succeed in industry. In a general sense, institutions of higher education, especially graduate schools, do a really good job, I think, of cranking out prospective financial analysts and engineers, managers, and the like. But what about the multidisciplinary skills that allow candidates to quickly grow into star real-world performers? Very important. Well, the Massachusetts Institute of Technology is addressing that very concern with an interesting new master's degree track that combines design, engineering, and management into a single degree. Good idea. MIT's Integrated Design and Management program will provide students with a complete understanding of the skills and tools needed to succeed in today's complex and fast-paced world of engineering. They'll also be trained in the practicality of the things that they will be designing and building. They'll learn to answer and ask questions about cost and value and customers and competitive advantage. All the things that good managers need, of course, to understand, to not only create great products and services, but also to successfully bring them to the marketplace as well. Again, this is a relatively uncommon in graduate study. Most graduate tracks in engineering only provide a cursory nod towards business practicalities, and few, if any, business programs even really consider engineering at all. But MIT's Integrated Design and Management program, as its name might suggest, will expose students to both sides of the equation, an alignment and synergy of left brain and right brain thinkers. As program director Matthew Cressy says, quote, "I want to empower designers to speak up and provide them with the management tools to effectively communicate their vision. My hope is that this program helps designers demonstrate that great design can be a competitive advantage." The program is now seeking applicants for an initial cohort of 11 to 20 students. So for more information on that, check out the story link right below the video player screen, right down there. Good idea.
Yeah. What this reminded me of, and this was when I was going to Santa Clara University back in 19. What they did with their engineering program there, they were doing something which was unique at the time. I don't know if they're still doing it or if other schools do it, but they were requiring engineers to actually take more advanced English courses and grammar courses, because they were getting pushback from industry at the time saying, you're turning out great engineers, but they can't write a report for Jack, right? I mean, and that was a complaint. It's like, we want engineers who can actually communicate what they're doing, be able to write a report, be able to explain what they're doing. And it's kind of the same idea, is more and more engineers are more and more involved in the entire system, and in order to do that, they have to have the right background.
Well, and you need, and engineering departments need great managers. They really need managers who can understand how, again, designing great processes, great products and services can connect with making money, and giving them the background in understanding markets and marketing and customers and value is really important. Designing in a vacuum doesn't help industry that much. It's good, but if you can combine those two things in a multidisciplinary approach, it's going to be better, and industry is going to get better eventual managers.
Well, it actually also helps them, because I wonder how many in the past engineers have had really good ideas, but didn't know how to communicate the value proposition of it, and it got shot down because they couldn't communicate the value that it would provide to the company, right? And so somebody who sees it and they don't see the value, and they shoot it down, and maybe a good idea gets blown away because of lack of being able to communicate on them at a management level, at a value level.
It hurts the engineers too, because they hit a ceiling in their careers much earlier where they really can only go so far. If you can penetrate into management, you'll do better. So good program there from MIT. Check that one out.
Okay, well, if you work within an FDA-regulated industry, like, let's say, life sciences, you know that the number of rules and regulations and restrictions have only continued to grow. Many life sciences companies, even small ones, need a person whose only job is to keep up on FDA regulations and whether the company is in compliance or not. And there's a lot going on, a lot of rules, and compliance is a big deal within FDA-regulated industries. But according to our next guest, the FDA isn't only about compliance. The organization is also interested in and invested in ensuring product quality. Larry Spears, president of L. Spears Consulting, LLC, spent 34 years at the U.S. Food and Drug Administration. His last position was as Deputy Director for Regulatory Affairs. He is the author of this week's article, 3 FDA Initiatives That Affect Life Sciences. Larry, thanks for joining us.
Thank you. It's good to be here.
So, Larry, we typically think, I think most of us, mostly because of the news, we think of the FDA as kind of the food police or maybe the drug police. But you say that they are a lot more than that. I believe you said that the FDA doesn't want compliance to overshadow quality. Can you explain that a bit?
Yes, Dirk. The FDA really has a mandate to make sure that products that are going on the market are safe and effective. So they will ensure compliance with the requirements, with the established laws and regulations, but as part of that, they're looking to ensure that products are safe and effective. So they need to ensure that products are really of high quality. That's one of the things that's very important to them. And there's a strong connection between compliance with regulations and with quality. So in my experience, as FDA regulates, and as they look at the way that they regulate, they're really looking at not just the letter of the law, whether that was met, but that companies are following their own procedures, that they've adopted best industry practices, or developed other practices that are just as good to help enhance quality. So in other words, they're looking to see that companies have adequate quality systems in place to ensure that their products are well designed, to make sure that the procedures and processes are well established, and that their systems are also capable of detecting any failures to meet specifications, and also that they have a system in place to correct and prevent those failures when they do occur.
Okay, now in your article, one of the FDA initiatives that you mentioned is called, the Case for Quality, which has really a really nice sounding name. But your description of it raises a couple of questions, I think. And one of the prongs of the Case for Quality, as they describe it, involves inspections. But my understanding is that the FDA is somewhat understaffed as it is, to perform the amount of inspection that it already has on its plate. So how is this actually going to work?
Well, Dirk, that's a good point. The FDA certainly could use additional inspection resources. There's no question about that. But they've historically been very effective in planning and performing inspections based on risk. So they determine what the particular products pose in terms of risk to the patient or the consumer, and then they adjust their schedules for inspections accordingly. The Case for Quality really involves working with the industry to improve product quality. And as I understand it, one of the tenets is to determine whether changes in the way inspections are conducted is worthy of consideration. I'm not saying FDA will do more inspections or that the inspection process will change under the Case for Quality. We have to kind of wait and see what actually comes out of this additional activity. And I don't know how it would or could change any of the inspection numbers. What I'm saying is that FDA, and actually particularly CDRH, has made a commitment to collaborate with the industry on helping improve something that is very important to each of them, and that is product quality.
Larry, another initiative that the Transparency Initiative aims to make, which does is it aims to make product approvals, new initiatives, and regulatory violations for most regulated products available for public view by posting untitled letters and warning letters on its website. We can see the value in that, but only if the public knows that they're there. So what does the FDA hope to accomplish through that initiative?
Well, overall, Dirk, I think it's really important that greater transparency helps the industry understand more clearly FDA's thinking and their operations. It helps them understand their trends and their initiatives. I think FDA wants to be open and interactive with the industry, and I think they've demonstrated that time and time again. So having this transparency initiative, putting information on the website, warning letters, untitled letters, like you said, helps companies to better understand things like when they have to plan for inspections, when they have to develop and submit new products for approval, when they may need to recall a product or provide safety alerts associated with products they have on the market, or when they're faced with a possible enforcement action, which certainly can happen, or when they're considering maybe new business ventures and how FDA could impact them. So it really helps the FDA as well to be more efficient, I think, as they get information from the industry that's clearer, that's more in line with their expectations, as they receive better product submissions, this allows them to use their resources more wisely. And it also helps them focus their inspections in areas where there is the greatest risk.
And Larry, at the very beginning, I said that kind of our perception of the FDA is more of kind of a watchdog, kind of a policing organization that's going out there and looking for somebody to mess up in the food realm or in drugs and so forth. Have they always had kind of this quality approach or this eye towards quality, or is this a fairly new thing?
I wouldn't necessarily say it's a new thing. I think there was a focus for a long time on making sure that companies are compliant, but quality's always been there. There just hasn't been as much of a focus publicly on their interest in establishing or ensuring that quality is high in terms of products and processes. So this has been highlighted more in recent years, no question about it. Certainly the case for quality is just another initiative that has basically brought to light the fact that they're interested in doing this. But this is something that has been around for some time. And I think the agency has become more open through the years. They understand the need to have more of a partnership between the FDA and the industry. It's not just we're the watchdog and you are the regulated entities, but we need to work together in a partnership to improve public health. We don't have all the answers as an agency. The industry doesn't have all the answers either. So working together, we can hopefully get to the answers that are needed.
Okay. Well, Larry, we're going to be talking about this a lot more next week. We do have a webinar coming up that is FDA initiatives and regulatory trends for life sciences. And this is going to be webinar is next Tuesday, April 21st at 2 p.m. Eastern, 11 a.m. Pacific. And Larry and I will be talking about this more. Actually, Larry will be talking about this more. I'll just be asking questions and standing by. So Larry, thanks for joining us this afternoon. And if anybody's interested, you can link out to the story on the player page, and there is a link to sign up for the webinar down there. Larry, thanks for joining us.
Thank you, Dirk. It's a pleasure to be with you today.
Okay. See you next Tuesday.
Thanks, Larry. Yeah, see you Tuesday. Yeah, you're doing that webinar with Larry, I believe.
Right.
So you're kind of co-hosting that one, and it'll be a good webinar. We look forward to that. So yeah, and you can actually sign up for it, I believe, through the article that Larry wrote for us. And
right.
There's a link right there where you can go out and sign up for the webinar now if you want to find out more about this. And look out for your emails as well. We'll be blasting another email to you early next week to remind you about it as well, so you can find out about it that way.
There you go.
Alrighty, well, we're talking now about automation. Automation cuts a wide swath from industrial waste is the name of an article that we ran in Wednesday's issue of Quality Digest Daily from our very own Ryan Day. That's right, Ryan Day, our intrepid reporter Ryan Day, and the article again was automation cuts a wide swath from industrial waste. And that, again, appeared in Wednesday's issue of Quality Digest Daily. Ryan is our intrepid QD reporter here. He always finds a story. Ryan always finds a story within the PR that we get from various people that send us PR all the time. Ryan's great at doing that. He takes the strands of ideas and he says, there's a connection here somewhere. And
you don't have to make one.
He finds it. He finds these connections. This was a really good one because in this case, he tied together the unlikely trio of KUKA Robotics, Schlafly Bottle Works, and Siemens Rolling Stock. Now, what's a robot manufacturer, a brewer, and a builder of light rail systems have in common? That's not a joke.
Okay.
It sounds like the beginning of a joke, but it's not a joke because the commonality between those three is automation, just as you found out in the title. Further, it's not just the attitude that automation exists for the sake of automation. What all three of these organizations are doing is they're actually using automation in a very interesting way, in a tactical way, in a strategic way to improve their organizations and to lean out their organizations and their organization processes and to drive revenue, to save costs, drive revenue. That's what we're all trying to do.
And we should also clarify that by one of the interesting things about this article is kind of the definition of automation.
Yes.
And a lot of people don't even call it automation, but it is because it's so ubiquitous that we don't even think of some of these things that you're going to talk about as automation, but they are really.
They are, and it involves hardware as well as software. It really what it's designed to do is, and we will talk about this, it's really designed to get the human a little bit, or a lot in many cases, out of the system. A lot of things that are done in manufacturing today, as we all know, are fairly mundane. I mean, and then at least they were fairly mundane for humans in past generations. Well, those mundane elements of manufacturing, of doing stuff, automation is beginning to weave those or distill those things out of the process. So it's pretty interesting. Well, let's look at the three organizations you talked about here a little bit, because I think it is illuminating how each of these is using automated systems to improve what they're doing. KUKA Robotics, of course, they're a very sophisticated robotics manufacturer, and they're using very sophisticated CNC software to ease the burden of the human-machine interface, right? I mean, there's a lot of programs and routing programs that are being done now that are very complicated that, the CNC software allows you to do that, and KUKA's using that to a large extent. That's how they're using automation in a certain extent. Schlafly Bottle Works. Well, in the case of Schlafly, a brewer, of course, they had faster than expected growth. They had a humongous growth, and they had to figure out ways to automate their systems to enable them to meet what they needed to have in terms of the growth of cases and barrels of beer that they were shipping. And they use automation control of the brew house itself to, again, kind of manage what were previously human operations much more efficiently. And these were things like turning off valves and turning on valves and things that were, when humans do these things, let's be honest, humans are not generally going to be as efficient as a machine. A machine you can program to turn a valve on and off, hundreds of times during the course of a day, right? I mean, you can do that right on and get it as efficient as you can. I think that the number was 30% or more was the growth in the amount of beer that they were able to do just through bringing in this automation. So huge increase in efficiency and bottom line growth in terms of their product line. And finally, this one, Siemens Rolling Stock in Sacramento, not far from us here. They use portable CMMs and CAD software to save a lot of time and eliminate drawings and reduce human error, right, in terms of what their process is. All of these are really about driving fallibility, I think, and waste out of the system. Often, especially with highly redundant, highly repetitive and mundane tasks, as mentioned, that means reducing the role of humans to do these kind of tasks. I mean, the people that were doing these things in the past now can kind of be shifted to do more value add and more strategic work within those organizations. That's really the goal of automation, is to get people out of doing things like turning on and off valves. I mean, why do that? You can have a system do it for you. The people that were doing that, watching a valve and probably weren't going to be able to do it as efficiently as a machine, can now do something else. They can look at redesigning the flow of the whole plant, perhaps, or they can look at redesigning the way they ship the product out of the plant, or they can look at getting rid of some other non-value adding processes. I mean, it's all about looking at what you're doing from an overall perspective and looking at what the hardware or the software, or the hardware and the software working together, can do to free up a lot of your human capital, and also to save time and efficiency and money. And that's really what automation has in common with all these stories, as Ryan talks about.
Right, and I want to touch a little bit, because I was able to go to Siemens and get a fantastic tour of their light rail facility down there. It's amazing. In
Sacramento,
but I mean, here you've got a facility which only cranks out 50 to 75 units light rail trains a year. It's precise, but it's also a lot of they don't like the word handcrafting, because that kind of indicates that maybe each train is different, but it's not really the case. But there is a lot of manual work that goes into it. And they don't think of it in terms of, when I mentioned automation to them, they went, no, we don't use any automation. And yet you go down there, you see automation all over the place. They just don't call it that.
So what do they call it? What terms do they use?
They just don't think of it. I mean, they're really tied, for instance, into scheduling software in order to put their trains out on the schedule that they want and make sure they meet shipping deadlines right on. They use some software called Primavera. Primavera is an Oracle company, or Oracle software. They follow their schedule religiously, but they don't think of scheduling software as automation. Well, in the past, I guarantee you if they were scheduling at all, somebody was, okay, a little ledger and this has to be done at this time, and somebody would have to consult that ledger and send an email or go over and talk to, hey Frank, how come you're late on this?
And those minutes add up to a lot of wasted
scheduling software. Scheduling software is automation. Automated CNCs are automation. Like you said, they were using at one time. They were taking. This sounds funny, but they aren't the only company that was doing this. They have a CAD drawing, so a 3D digital drawing that's supplied to them by a vendor.
Yep.
And what they were doing is taking that 3D CAD drawing, converting it to 2D paper drawings, sending these paper drawings out to their inspection line where they would compare their product to a 2D drawing and then go back and compare it to the CAD drawing.
Yeah, right.
Okay?
Think about all the wasted steps, all the muda in that process.
Exactly.
Right?
So now what they're doing is they're inspecting, or will be inspecting actually very soon, direct to CAD, where you have your CAD drawing, you have your ferro arm with a scanner, scanning the thing that needs to be inspected, comparing it directly to CAD, no paper, a lot faster, a lot less room for error. That's automation.
That's automation.
It's automation.
That's what the story is all about. Good story. Check that one out.
All right. So moving along here, let's talk about the importance of visualizing your work. Visualizing work can't really be stressed enough, and here at Quality Digest, we're nothing if not stressful.
And stressed.
There we go. So in light of that, we ran a useful article by Jim Benson titled 9 Questions You Can't Answer If You Don't Visualize Your Work. As Benson says, when we don't visualize our work, that is, turn it into something like a map of the real world, we can't see what we're doing. We can't immediately answer these 9 key questions. And we're just going to go through these really quick here. Number 1, what is being built? It's helpful to see what you are working on. Even in knowledge work, writing something down like a list is a visual tool. Number 2, who is currently working? If we want to collaborate with someone, understanding what her current workload is gives us a good indication of when we can impose ourselves on her. Number 3, who is currently idle? Idle workers, people with no tasks at all, can be a sign of a workflow issue. So being able to visualize that, maybe on a Kanban board, is important. What is stuck? If any of you use a Kanban board, and we use one here, stuck notes are really easy to see. Something that dwells in a column on the Kanban board longer than is comfortable can be dealt with through a discussion. Teamwork or simply killing the task. With no visualization, tasks can become stuck for months because nobody knows it's stuck, right? Otherwise, but on a Kanban board, you got a sticky note there, and it's there, and it's there, and it's there. If somebody comes along and says, why isn't that moved? Yeah. Okay, number 5, who needs help? Human nature. People don't often ask for help when they need it. Being able to visualize a stuck person, and often, if you think about this, a stuck person is often synonymous with a stuck project. Mm-hmm. Perhaps you can see this using the Kanban board. This will tell the team that maybe this person needs some assistance. Number 6, who is overloaded? Kind of like a stuck person, maybe. Visualizing work quickly shows who has too much work right now. That could be the reason why that person is stuck. Mm-hmm. Number 7, when can I expect to see something? Viewing work on a Kanban board can help with estimated completion times, says Benson. Not necessarily visualizing this, let's say, on an individual task level, but rather work items viewed in the aggregate. So if you're using your Kanban board and you're keeping track of how long it's taking something to move through the schedule, a project, again, not necessarily individual tasks, but let's say an overall project, it's going to be easier for you to estimate the end time of it. And by the way, this doesn't have to be done on a Kanban board. There's other ways to visualize tasks, Excel spreadsheet with milestones, a lot of ways to visualize. Number 8, being able to visualize what you have finished. We need to have a visual record of what we've done, or we'll actively forget both the work and its context. And finally, number 9, what's coming next? Knowing what work is approaching helps us to do our work right now, says Benson. Kind of makes sense. Seeing work as it's coming up allows us to better plan for our time. So I think we've all had this happen when you're not visualizing your work. You're working away, you're working on your project, and then your boss comes up and says, so when are you going to be able to start on the next project? And you're like, what next project and
right.
when was that scheduled? Well, if you're able to see it all the time, you know that, okay, in 3 days I've got to start on this next project. I got to crank things up, I got to get going, I got to finish up the project I'm on. And if you're keeping that in front of you, visually you know that you have a project coming down the pike and it's always in front of you, it helps you to plan for that. So there you go. 9 questions that you can't answer if you don't visualize your work. And thanks again to Jim Benson for that article.
Yeah, it's interesting. We as humans have 5 senses, but the sense of vision, of sight, is really the primary in my mind. The
right.
primary,
particularly in the workspace. I think
in the
too.
workspace.
Yeah.
I mean, visuality is not just a thing. Visuality really is a methodology to see flow and to see work go. And Jim is really, really good. Jim is like kind of a Kanban master.
Yeah, exactly.
Really, I mean, and read his stuff if you're interested. If you haven't really worked with a Kanban, read his stuff. And again, you can always, as you always say, you can always get content by Jim Benson in the search bar
right.
on our website. Jim's got a lot of great articles on our site about visuality and Kanbans, and check that out if you're interested in flowing up your work, freeing up the flow of your work. Okay.
Yep.
Well, we're getting close to the end of the show, and time now for our tweet of the week. And this one ties in directly with the automation article that we chatted about earlier, which is no coincidence since the author of that article, and QD's tweetmaster are one and the same guy, Ryan Day. All right, so Ryan found this one from Twitter user Lem Fugit, I think that's how he pronounces it, who tweets, "Is Jimmy the Robot the next Brad Pitt? What android will fill in for Angelina, as if any android could? Stay tuned." Well, that tweet ties in with the news that Hollywood is courting, I didn't know this, but Hollywood is courting Jimmy the Robot from Intel. Very interesting. Warner Brothers has actually optioned the film rights to the book about Jimmy, titled, appropriately enough, 21st Century Robot. So maybe we will see Brad and Angelina in this one, or maybe it's just going to languish in robot movie development hell. Only time will tell. So, for more great tweets on technology, automation, standards management, and a whole heck of a lot more, be sure to check us out on Twitter at Quality Digest. Okay, well, that's our show, but before we wrap it up, we'd like to offer thanks to today's sponsor. Hexagon Metrology is committed to helping you control your processes, enhance the quality of your products, and increase efficiencies. They empower you to stay one step ahead of a changing world with their wide range of product offerings, nearly 200 years of expertise, and an extensive support network. Hexagon Metrology, where quality comes together. For more information, just click on the banner ad just below or just to the right of the video player screen.
That's right. And before we go, just a reminder, the Sparta webinar with Larry Spears coming up next week, FDA initiatives and regulatory trends for life sciences. Remember, that's Tuesday, April 21st, 2 p.m. Eastern, 11 a.m. Pacific. If you are in a FDA-regulated industry, you don't want to miss that webinar. Of course, it's free, so the price is right. So there you go. Sign up for it.
Yeah, sign up for it through Larry's article, or again, keep your eye on your email on Monday for another reminder about how to sign up.
That's right.
So that's our show. Yeah, thank you. Thank you all for joining us. Thank you, Larry Spears, again for being on the show, and thank you all for being there as well. We will see you next week for another week of QDD, and we'll see you next Friday for QDL right here.
So long.
Have a good weekend. Bye.
Four, three, two, one, fire.